Hi, I'm Rafe Roberts, Chief Executive of NHS Borders, and I'd like to spend just a few minutes talking about our local health service. We aim to provide safe patient care, and we're very proud both of our reputation and the commitment of our dedicated and hard-working staff. However, as a society, we're all expecting more from our healthcare services every day, and providing the service the way we want is not always easy. Personally, I'm very clear that NHS Borders, as the provider of a local health service, should be seen as part of our local community, and we therefore want you to be involved and engaged both in the care that you receive on a day-to-day basis, but also in shaping how we provide services in the future. To do this well, we should start by understanding the pressures we face and how this is driving the need for change. The NHS is now over 70 years old, and we can see that the services we deliver today are very different for those that were there when the service began in 1940. Secondly, we know that the number of older people in the Borders is increasing rapidly, and more rapidly even than elsewhere in the UK. While this is obviously a positive and a measure of the success of the NHS and improvements in our health and lifestyles, as people live longer, we do know that this has an impact on their need for increased support from health and care. The other side to this change in our population is that we're also seeing a reduction in the number of people of a working age, and as this continues, we expect this to have an increasing impact on our ability to recruit and retain staff. Finally, the development of technology, equipment, new drugs provides us with amazing opportunities to deliver healthcare differently. As a result, we now provide treatments we never even dreamt of, whether that's heart transplants or many of the cancer treatments that are now available. However, this also creates demands on our staff, the need to provide new equipment, space in our buildings for that equipment, training for our staff, and ultimately pressure on our budget. As I've already said, our services have continually changed, and I would like to give you just a couple of examples. Many of us will remember the time when we had large institutions for those with mental health conditions. For example, until the start of the century, we had Dingleton and Melrose, where patients might stay for months or even years. Now, however, we are able to care for most of these patients in the community, and as a result, give them more opportunities and a much better quality of life. Similar changes have taken place in the Borders General Hospital, helped by advances in technology and clinical practice, and also the recognition that patients staying in hospital for longer than is needed is not actually the best thing for them. For example, when the BGH opened more than 30 years ago, there was a ward where we cared for patients who were coming into hospital for eye operations, and they may have stayed for a number of days after their operation. Now, patients coming in for a cataract operation will be admitted to the hospital, have their operation and be discharged all on the same day. Similarly, patients coming in for a hip replacement would have stayed in a hospital bed for weeks. Now, you may well have your operation in the morning and by the afternoon be up and around moving about the ward. You will often also be discharged within 24-48 hours and then be cared for and supported with physiotherapy in the community. Ultimately, this gives you a much quicker recovery of your mobility and a better quality of life. We also often think of the NHS as just being about looking after us when we're ill. However, we also have a responsibility to help you to improve your health and keep you healthy for longer. Linked to this, we need to recognise that the most important reasons why our life expectancy and health has improved so much in the past has actually been a result not of improved health treatments, although this has obviously had an impact, but actually of improvements to our lifestyle. For example, better diets, improved housing, a focus on safety at work, and more recently, new smoking legislation and legislation around minimum alcohol pricing have and will have significant impact on our lifestyle. We are therefore keen to think carefully about how we can improve our focus on preventing ill health, reducing health inequalities, and supporting you to enjoy living with good health for as long as possible. So what does all this mean for the future of our health services? Firstly, we want to be able to provide healthcare in the right place, at the right time, and by the right member of staff. This will mean more patients cared for at home or in their community, and for us to spend more of our resources on services outside hospital. To do this, we will work more closely with social care and create a single team that will support all your health and care needs in the community. This should ensure you only get admitted to hospital when you really need this, and if a hospital admission is needed, then we will look to make this as safe and as short as possible. Obviously, some people will always need to come into hospital, and we will continue to provide acute hospital services on the Borders General Hospital site, except when it is more appropriate for you to receive specialist treatment in a hospital in Edinburgh, perhaps for complex heart or cancer treatment. Information and digital technology has changed out of all recognition in the last 20 years, and no doubt this will continue. We want to use this technology to support you at home and provide new ways of accessing services such as virtual or remote clinics, so that you don't even need to travel to speak to a doctor or nurse. There are also opportunities for our staff to work differently. Many of the tasks that would normally have been done by one member of staff is now being done by somebody else. For example, when you visit your GP practice, you may well now be seen by an advanced nurse practitioner or a pharmacist who can do many of the things that a GP would previously have done. This allows our GPs to concentrate their skills and experience on the patients with the most complex needs. This is a good use of our resources, but also helps with recruitment challenges and provides a great opportunity for our staff to have more interesting and rewarding work, and in turn that improves our ability to recruit and retain other members of staff. We must therefore think carefully about how we create services that are sustainable with the workforce that we are going to have in the future and not the workforce that we currently have. So in conclusion, the underlying message is that we must embrace change. Healthcare services change and evolve over time, and if we do not embrace this, we will not be doing the best for the Borders. We have approximately £250 million to spend on healthcare services each year, and while we know we could always spend more, our budget is limited. It is our responsibility to provide you with the best possible healthcare from our budget. As we move into 2020 and the coming decade, our clinical strategy and recently published statements of intent set out just some of the ideas we have about what we want to achieve and what this might mean, so that we can continue to provide the best possible healthcare in the future. However, it is really important to me that we get your views and thoughts on the future. We're therefore looking for your input and would like to involve you in our future. Please therefore do get in touch and get involved in shaping what, at the end of the day, is your NHS.